to everyone. Hey, this webinar is being recorded, and a very warm welcome to you back to the Debra International, Debra Singapore, and PEOF partnership-led patient engagement webinar series. Thank you for joining us if you're coming here for the first time, and for those who are joining us for the third webinar in the series, welcome back. I think we're going to have a lot of fun today. We've got an amazing session ahead, but could we just go to this slide? Okay, Eleonora's prompting me that the title of this session is Advancing Advocacy Through Collaboration. So this is our attempt to share some of the insights, some of our learning and experiences through our panelists on how to collaborate with a variety of stakeholders in scaling up and skilling up your initiatives and your advocacy attempts. So we are going to be using an AI live translation tool called Wordly. Eleonora, if you could just, okay. Is it enabled already? I'm just trying to find it.
Yes, you should have it in the meeting chat. You should have received a message from Matt.
Okay.
In the chat. So if you open your chat, you can open Wordly.
Thank you. So there is a chat in the chat. If you click on open, you will see Wordly, and then you can choose your language. I'm just going to do it with you simultaneously so I can guide you through it. Just waiting for it to load. This is pretty accurate. So you'll see that my language is English, and it says the speaker's language is English. On the top, if you can click on the drop-down menu, you will see multiple options. So for example, if you want Tagalog, just scroll down. Let me just see. You will see it as the first language under T. So you can get Tagalog, or you can get Swedish, or any other language, including Punjabi for you, Anand. Not that you need it, but there's a variety of languages here. So please pick the language that you prefer. And for sure, Mandarin is there for you, Ili, if that's what you prefer. And you can get the content in the language of your choice. So before we get started, may I remind you to please put your mobile phones on silent. Even though you're in the webinar, you will be muted, but when you're speaking, it'll be nice to not have background noise. Please be ready to engage with our speakers, because this is not really them speaking at you, but speaking with you. It's more or less a conversation with you, a Q&A session if you prefer. And let's go to the next slide. Thank you. So why are we here? Today's agenda. I'm going to discuss, I'm going to take you through these series in the sense that what did we do in the first two webinars? This is the third one. And in this session, what we plan to do is to talk about collaborating with a variety of stakeholders, such as policymakers, industry, and researchers and clinicians. These are some of the commonest stakeholders that all of us, we patient advocates, work with. So the way we structure this today is our panelists will share some insights with us for about 10 minutes, approximately on what they've done in their journey. But they are already at a level that we really admire and respect. So we don't want you to get daunted and intimidated looking at the amazing stuff they've done. So we'd like to engage them in breakout sessions. So we will be having breakout sessions, and you will have an opportunity to talk to them one-to-one. So our speakers will rotate. You will stay in breakout rooms. So Elle, the next one, thank you. So the first session, to remind you, those of you who are here for the first time, to share with you, and those who are back, to remind you, the first session was called Introduction to Patient Engagement, where we talked about what exactly patient engagement is and what it isn't. In the second session, we talked about evidence-based advocacy. How can you increase the impact of what you do, what you want to do, through generating and collecting and using evidence. So the hyperlinks will be shared in the chat to the outcomes of the 2 webinars previously. And Eleonora, are we sharing that? Because I'm seeing the wordly translation. Okay, there is Melis who has shared the output, the links to the previous 2 sessions, but of course they're also available on the PEOF website, on the Synergist website. So just send us a message if you would like access to them directly, we'll send them to you. So today, what can you expect from this session? Case studies and examples on the kinds of engagement. How do you engage? What do you do? What's the first step? How do you scale up? Next. What are the resources? So we don't want to just hear this and have you furiously making notes. We want you to be able to get access to resources that you can use after these webinars are over. And while we send these resources to you, I also request you to feel free to point us to other resources that you feel may be useful to our community of patient advocates. And finally, be prepared to ask all the questions that you had but never knew who to ask about multi-stakeholder engagement. Next. So I'm going to be moderating this session, and I'm really proud and honored to be introducing our amazing panelists. We have Joseph Guzman first. I think Joseph doesn't need an introduction as an advocate for psoriasis awareness and patient empowerment from Asia Pacific, but also for the really amazing work that Joseph has done with Geneva. And I will let Joseph explain more. But the second person we have on our panel today is Ravdeep Anand. Ravdeep is the father of a person with Duchenne muscular dystrophy. And currently, Anand is in Paris, and I had the pleasure of meeting Anand. Was it just last week, Anand? I can't believe it. It was just last week that we met in India, and I was so inspired by his story, his and his wife's story. And the third on our panel is Mr. Neil Wildman. He's a Senior Director of Patient Advocacy from Pfizer. And so we bring perspectives both from industry as well as from patient advocates who've done work in collaborating across the table. So next, I will pause now and hand over the floor to Joseph, who will talk to us about patient leaders as change makers in health advocacy. So warning, don't get intimidated or completely dazzled by what Joseph says, because you will have an opportunity to talk to him in a breakout session after the 3 speakers have finished speaking. Joseph, all yours. In case you're speaking, yeah.
Okay.
Thank you, Joseph.
Okay. So what should I talk about? Okay, there you go. Okay, welcome everyone, and thank you for joining us today as we explore how patient leaders are driving meaningful change in health advocacy. My name is Joseph de Guzman, and I am honored to share with insights from my journey and the collective efforts of patient advocates across the world. Together, we are reshaping how health systems respond to patient needs by empowering leadership from within the patient community. Next slide, please. Okay, so let's talk about what do we really do as an advocate. The cornerstone, we have 3 pillars, actually. Most of the advocates have 3 pillars. We have the access. Access to healthcare is more than just being able to see a doctor. It means that healthcare services, medicines, and treatments are geographically, economically, and culturally available to all. Many patients, especially those in rural areas, often find it difficult to reach healthcare providers of specialized treatments. As patient advocates, we fight for policies and systems that reduce these barriers, making sure no patient is left behind. And of course, we have the second pillar is the affordability. Even when healthcare is accessible, many patients face financial challenges. Treatments, consultations, and medications can be prohibitively expensive. The burden of healthcare cost is particularly high for those living with chronic conditions like psoriasis, who requires ongoing care. Advocacy here involves pushing for lower medication costs, insurance coverage improvements, and government subsidies to ensure healthcare remains within the reach of everyone. And of course, the quality. Advocacy is not just about availability and affordability. The quality of care, it matters just as much. Patients deserve high quality healthcare services tailored to their needs. This includes compassionate care, accurate diagnosis, effective treatments, and a system that listens to and respects patient feedback. As patient leaders, we strive to ensure healthcare standards are continually improved, especially in areas where patients feel underserved or neglected. Next slide, please. Okay, so patient advocacy's goals, the goals of patient advocates are to ensure access, affordability, and quality in healthcare. And the hurdles we face in achieving those goals, like resources limitation, access issues, and stigma. By recognizing and addressing these barriers, patient leaders can create more effective, inclusive, and transformative advocacy efforts that genuinely meet the needs of patients. So, what is the current state in Asia? In Asia, for example, we face unique challenges, including resource scarcity, healthcare access disparities, and societal stigma around chronic diseases. Many patients hesitate to speak up, fearing judgment or discrimination. However, patient advocacy is gaining momentum. With forums like this, thanks to Ritu and the Patient Engagement Open Forum, with patient leaders increasingly stepping up to bridge the gaps and advocate for the community. Next slide, please. Okay, overcoming barriers to patient advocacy. Okay, let's talk about resource scarcity. A major challenge in patient advocacy is the lack of financial resources. Advocacy efforts requires funding for campaigns, awareness programs, and initiatives that directly support patients. However, in many regions, especially in developing countries, these funds are limited or non-existent. Advocacy groups often rely on donations, grants, or partnerships, but these sources can be very unpredictable. Addressing resource scarcity requires innovative fundraising, strategies, seeking partnership with organizations, and pushing for more government or institutional support for patient advocacy work. Healthcare access. Geographic and financial barriers significantly limit healthcare access for many people, especially in rural or remote areas. Patients may have to travel long distance for specialist consultation. Imagine the Philippines, which has more than 7,000 islands. And we have the scarcity of specialized doctors in the country. It can be costly in both time and money. Additionally, financial constraints such as high treatment costs or lack of insurance further reduce access to necessary care. Advocacy efforts here focus on breaking down these barriers by calling for more community-based health services, telemedicine options, and universal health coverage schemes that makes healthcare accessible regardless of location or financial status. Societal stigma. One of the most invisible yet powerful barriers is the stigma associated with certain chronic diseases. Take psoriasis, again, for example, and mental health conditions. This stigma can prevent patients from speaking out, seeking treatment, or joining advocacy movements. Fear of being judged, ostracized, or misunderstood often keeps patients silent. Advocates, Advocates play a crucial role in breaking down this stigma by raising awareness, educating the public, and creating safe spaces where patients can share their stories without fear of discrimination. It is through continuous dialogue, public awareness campaign, and patient empowerment that we can dismantle the societal stigma. Next slide, please. So what are the strategies we can use to overcome the barriers to patient advocacy? Despite the barriers we face, we've developed several strategies to overcome them, like capacity building, where we equip patient leaders with training and skills development, fostering confident advocates ready to influence change, community engagement, building strong connections within local communities helps raise awareness and mobilize support. Advocacy network. By connecting patients and organizations, we can work together towards common goals, amplifying our impact. Policy advocacy, engaging with policymakers to ensure that patient voices are heard in healthcare decision making. Next slide, please. Building effective partnership. Collaboration is key to driving systemic change. We focus on building partnership with key stakeholders. Most important are patients, whose first-hand experience provide valuable insight. The healthcare providers, of course, they offer clinical expertise and patient care. Policymaker is a very important segment of the partnership. This is where the power to implement necessary reform happens. And then the community organization, which provide essential support for advocacy efforts. Next slide, please. Leveraging on technology, I just have to underline this topic. Leveraging on technology for health advocacy. In today's digital world, technology is a powerful tool for patient advocacy. Through social media, online platforms, data analytics, and digital health tools, we can raise awareness, connect with the patients, and shape more effective advocacy strategies. And next slide, please. I believe this is my last. Developing leadership skills for patient advocates is very important. Lastly, we emphasize the importance of developing leadership skills among patient advocates. This includes providing training programs, mentorship opportunities, networking events, and hands-on community engagement to build the confidence and capabilities of emerging leaders. By empowering patient leaders and fostering collaboration, we can drive change in health advocacy, ensuring that patient voices are at the forefront of decision-making process. Together, we can create a future where all patients have equitable access to the healthcare they need. Thank you very much.
Thank you, Joseph. What a great reminder. But before we continue with Anand, I just want to call out that there was a question from Majeda on the chat. That was a real wake-up call for me, where the question that was asked was, who are the advocates? I think this is a great reminder that sometimes we get so used to the vocabulary in our community that we assume that everybody is on the same page. So thank you, Majeda, for, I hope I'm pronouncing your name right. I'm not sure whether it's Mahida or Majeda, but it is a great question. Who are advocates? I'm not sure who Joseph had in mind, but I was thinking people like you and me, patients, parents, anybody
Anybody could be an advocate. I can be an
Absolutely.
advocate for myself, for my brothers, for my sisters, for the whole community, for the whole country. It really depends on the capacity to lead, and I think your heart, where it is.
Yes, indeed. Anyone could be an advocate, including your doctor, your clinician, your nurse, your social worker, your policymaker, your member of parliament. Anyone can be an advocate, someone who speaks for you on your behalf. Thank you, Majida, for that. Okay, Joseph, thank you for reminding us that healthcare access, affordability, and quality is not the same, even within a country, depending on whether you're in a rural or urban area, in a developed or remote area. And stigma, you spoke of stigma. I cannot I cannot tell you how much that is important to people with EB and for other visible and invisible disorders. That is a topic that's really close to my heart, and I hope we can work in the region on stigma. And finally, the value of technology in scaling up our advocacy initiatives, in connecting with stakeholders, in the impact that it has the potential to create. So thanks for that, Joseph. I'm sure our audience wants to pick your brains in breakout sessions, but for now, I will let you sit back and we move to Ravdeep Anand, who is currently in Paris. And Ravdeep is going to talk to us about muscular dystrophy and the work he did, which is super impressive for me, how he frustrated with the lack of access and the lack of affordable access to therapy for muscular dystrophy. He decided to take matters in his own hand and to develop a new therapy. So as a mother of somebody with a rare disorder, that makes my heart sing. So Anand, over to you to inspire us.
Thank you so much, Ritu. Thank you so much, everyone. It's really wonderful to be here and to be heard. Without much ado, let's get started. So basically, it's the journey of as a parent living in India, like Ritu was saying, like the other gentleman was saying, there was not much research going on. There was not much that we could do for our children. We were relying on healthcare people. We were relying on scientists from other countries to bring in something for us, which was, of course, not being accessible and not being affordable. So that's when we decided that let's do something on our own. And then I started thinking what's important as a patient advocate to make sure that what we can do for ourselves here. So we move on to the next slide. Actually, we can start with that. So no, we can go to the next slide. Yeah. So this is the thought behind becoming an advocate for muscular dystrophy. There was a lot of research being happening around the world, nothing accessible to our children in India. Then we decided why not do something for ourselves. I got into research. I set up a R&D facility, and the problems that we face is that not many people know of us. So we had to do a lot of awareness, which takes us to the next slide. And so a lot of awareness would be doing a lot of road shows, a lot of campaigns. Then slowly people get to know that it's a painful process, but people do hear you, people do see you. And then when we start the process of trying to develop some form of treatment for our children, we have to make sure that we have to look into many aspects of the whole drug development stage, where we engage in research, design, and trials. We participate in clinical trials. We collaborate with policymakers. And of course, we have to partner with industry for the drug and device development. But all these things don't happen simultaneously. It takes a lot of momentum, a lot of collaborations, a lot of funding, and a lot of effort in creating awareness. So as we grow and we get into the whole process of setting this whole thing up, you keep on doing more awareness programs, get visibility, and that will help ease the process of setting up R&D and getting some form of treatment out for our children. And to the next slide, please. Yeah. So what would be our objectives when we are there's so many different people will have different end results, end points. Some of the quick ones we can run through are improving the quality and relevance of research. So when we go generally to scientists or to research organizations, they'll be working on so many different diseases, which is fine. But as parents, and our requirement is basically to do with our own disease-specific research. So if we become an advocate and we set up our own R&D facility, we can actually concentrate and focus on what we need to get something done. Shaping healthcare policies, that's another story that goes parallelly along with because so many diseases will not be there in the policies that are already existing with the government. So we have to add, categorize, so that we can get some benefit from the government. Then increasing patient engagement in self-management. Now was one of the fundamental things that me and my wife thought when we started our R&D process, is to set up a support system for other families. India being a huge country with a lot of population, very little access to actual knowledge and what's going around, not only in drug access, but also in management. Because before we get to a certain point where we have access to a drug, disease management is very important. And of course, once we get into this whole scenario of drug development, we make sure that the cost of the healthcare, the cost of what we need to manage and to the patient and to get some form of medication or treatment, we can reduce the cost a lot. So I'll be repeating the same thing here, so we'll just go on to the next slide. Now, once this journey started, we had to partner with a lot of foreign companies, researchers across the world. So we did a few conferences where we got stalwarts from all across the world in all the areas, whether it was management, whether it was medication, whether it was research. And that was a big eye-opener for all the patients, all the parents who had attended. And they saw that, yes, there was scope in what we were trying to do, because everybody unfortunately feels that this is something that we should leave it to the professionals, but they don't understand that the biggest professional for our disease is us. And so what we should keep in mind when we want to get going in this field is we have to be informed and prepared. When I say informed, you should know what's happening around the world. When I say prepared, we should be prepared that we will not be able to achieve everything that everybody else is achieving. So we have to be clear in our endpoints, our goals, and try to navigate our research and our work so that we can reach it faster. Communication, and then now in a place like India, communication is a big challenge. We have many languages, we have many states. Patients come to us from all across India to our state, and we need to make sure that we can communicate and tell them what to be done, what is to be done. And we need to do it ethically so that we don't rub anybody on the wrong side. Somebody already mentioned that we have to be an advocate, not just be a follower. And as parents, again, we have to balance our emotional and our practical senses, because what we would love to have may not be practical to have. And then in doing all that, we're lucky enough to develop a drug for our own disease. And we managed to do a single patient safety study So now this is the whole process of having two arms. You have a research arm and you have an NGO arm, and you have to work parallelly with both. At the end of it, what do parents want? They want a treatment. How do you get the treatment? We can do the advocacy, but if we don't have our own research, it becomes again very difficult. So these are some things that we barriers were already spoken, but opportunities is what we should look at. There's a lot of research happening with all the diseases across the world. Awareness is there today. When I started this journey, there was hardly anything on social media or Google. AI was spoken about, technological advances were spoken about. There's a lot of things happening everywhere, and patients must be, or I would say caregivers should be very open with the patients, the patient should be fully informed of the condition, of the journey, of the end point. And so it makes the patient more informed, and I feel it makes them sort of more open to adapting to the change that they will be going through over a period of time, which makes it easier for the caregiver also to manage the patients. Social stigma. I don't know if there's any country that doesn't have that. Okay, so we can keep talking about this. Another huge barrier would be, regulatory clearances and hurdles. We need to work with good organizations who are policy makers or draft policies, but we need to be actively involved and engage with them to make sure that we get our point across to them, and they need to pen it down in a way that the regulators can accept. Sometimes we write in plain English, which might be the actual truth and the fact, but those guys don't hear that, and so now this is the next very interesting stage of the whole thing. I'll go quickly now. So when you're developing a drug, you do R&D, you develop something, you get a regulatory approval, and then the question comes, who's going to manufacture the drug for you, for your trial or for whatever? And that's where the whole game changes as far as costs are concerned. Then you go to these big pharmas, and they charge you an arm and a leg to get you. And in India, it doesn't work. Our healthcare systems, our insurances don't have those policies where we can afford. So when we did this, we also went to different pharmas, and then we realized it's not going to work out. So we took the hit and we set up our own mini manufacturing facility that would serve only our requirement. We created a platform, and today that platform, with great pleasure, I can say, not only DMD can be helped, but we can go to other neuromuscular disorders like SMA, ataxia, and other things that we can develop and manufacture the drug for that also, if need be. This is a question that is thrown to me many times. The one thing I wish I had known, but there is no one thing. When you get into these things, there are many things. We have to be open. We have to be patient. We have to accept that at every step, you are going to get hit by something unexpected. The expected things are financial, scientific, regulatory, all those things are there. But it's like a maze, that photo that I've put there, somebody told, through experience, I'll tell you, research is something you open a door and there'll be 3 doors behind it. You can open any one of those 3 doors and there'll be another 3 doors behind it. And you can keep going on and on and on. And so the problem is that we had to really wear 2 hats, a parent's hat and a researcher's hat. As a parent, we wanted the drug as soon as possible. And as a researcher, these things take time before they actually, you can get access to it. So it was really a big challenge. But at the end of the day, I feel that whatever we did for the last decade plus, we have managed to get something going in India. Today, there are many people who are following what we are doing, and I hope that I will be able to help more and more people and convince them that, like Professor Joseph said earlier, that we need to lead, but we need to make sure that we have enough people following us so that we have numbers. And then once you have the numbers, whether it's research, science, policy, whatever it is, funding, when we have numbers, we can do anything we want. Thank you.
Thank you so much, Anand. I always think that, I'm the impatient patient, but you've told me the opposite, that you need to curtail your impatience and be the patient patient.
Correct.
I hear you. I hear you. I really like your reminders that we have to balance between needs and wants, what's practical versus what's aspirational. And I really like the reminder that perseverance is the key. You have to persevere. You cannot give up. And I also really like your reminder that communicating in the stakeholders' language is very important. Yes, we all live in regions that are very diverse. In Asia Pacific, it's rare to find a country that has one language or two languages only. We indeed have challenges of diversity, heterogeneity, multiple languages, but we all can take away this lesson from you that communicating in the language of the stakeholder, we're not talking about English, Hindi, Punjabi, or Tagalog. We're talking about the vocabulary that we need to communicate to the regulator, to the researcher, to the health policy maker. And unfortunately, despite the challenges of our work, that also is something that can improve our work if only we have the patience and the perseverance to teach ourselves the correct vocabulary and advocate in that language. So I'm sure our audience has, multiple questions for you, Anand, and there's so many texts that are on the chat. So please go ahead and read them, and we will have an opportunity to ask questions directly. But I'd like to go to our last speaker on the panel, Mr. Neil Wildman. Neil, over to you.
Thanks, Ritu, and thank you both, Joseph and Anand, for your inspiring stories. And hopefully what I'm going to share in the next sort of 10 minutes is equally going to help share some insight. So first of all, a little bit about me. So I work at Pfizer. I've been with Pfizer 16 years now, and all of that time I've worked with patient advocates. And prior to joining industry, I actually was a patient advocate myself. I worked as a advocate in the Australian mental health sector for the national peak body, and I continue to be an advocate as my 13-year-old daughter was born with a rare metabolic condition, and I continue to advocate for her and her well-being in the health system. So I've sort of sat on both sides of the table, and I'm hopefully what I'll share in the next couple of minutes will be of benefit. So I want to start by saying I cannot emphasize enough how important patient insights are to the pharmaceutical industry. And as we know, the patient voice is crucial when we think about clinical trials, we think about protocol design, when we think about helping with access and reimbursement decisions, and when we think about how patient support programs or access programs are set up from the industry. But fundamentally, why the patient and caregiver voice is so important to the pharmaceutical industry is that it allows the industry to listen, to learn, to understand, to react to the needs of patient and caregiver communities around the world. So there would be no industry without patients and the patient voice. And so it's crucial that these relationships between patient organizations and industry are really on a very transparent bedrock of equality. So I just wanted to start there. I'd also wanted to make a couple of overarching statements around individual companies. So I represent a lot.
Have
Hello?
we lost? Hello, Neil?
We lost Neil.
I think we may have not lost Neil. I'm sure he will reconnect. Yeah, Paul, I think so too. So it's pretty remarkable that we have the insight from Neil, who wears both hats of industry as well as a patient advocate. I'm sure Neil will be with us in just a moment.
I'm back, Ritu. Can you hear me?
Hi, Neil. Yes, we can
Yes.
hear. Thank
Sorry,
you.
I don't know what happened there, just dropped. So
No
I'll just continue on. So obviously large companies, matrix organizations. So you're perfectly within your rights to ask for one point of contact when engaging with companies. I think secondly, it's understanding systems and processes. So for example, funding cycles differ with companies. So most companies operate on a 12-month funding cycle, but if you're looking to step into a project where funding is going to be requested or required, it's really important to try to understand when is the right time to ask that company for funding to consideration of that project.
Sorry,
then
Neil,
last-
apologies for interrupting you, but do we have a slide that you're referring to? Because I see the slide is...
The next slide. Shall we go to the
Yeah.
next slide?
Yeah.
So if we
Perfect.
just build
Thank
it
you.
out, so just some of the fundamentals of partnership from an industry perspective, and from both perspectives. So firstly, respect for independence. I think that's a given. It's really important that industry respects the independence of patient organizations. I think secondly, open communication. And that needs to be clear and consistent from the start. So if you're not sure when engaging with industry, ask and keep asking questions. I think confidentiality is really important when you're stepping into potential partnerships. You know, it's incumbent on industry to respect the confidentiality of any engagements, and also from an advocacy perspective back. Accountability is important in terms of if you enter into a partnership, and this is from both sides, need to try and see it through. And I know that sort of life gets in the way and you have to be adaptable. But if you start projects and if industry commits to projects, then both parties need to see it through to the end where they can. And then before you do anything in terms of engaging with industry, I think it's important to make sure you have written agreements in place before you start. And within that, just be really clear around the roles and responsibilities and the expectations in there. So if you go to the next slide. So just some top line stuff regarding grants and requests. And, you know, you probably know all of this, but from my company's perspective, this is what we would look for in any sort of written request for project support. So outlining goals and objectives, really looking at why the project is important, where is it going to fill a gap that doesn't exist, what questions is it going to seek to answer as part of the project, who's the target audience, what is the design of the project, and then looking at what innovation might come out of this. Why is it different? Why is it new? And then they go on to talk around the evaluation and the outcomes. How will you measure impact? Because that's quite important if you're looking at sustainability of funding or maybe moving forward with the project into a second or a third phase. What's the dissemination plan? If you generate research or you wish to generate research, how will you communicate that out to stakeholders? Obviously, some basics then around the project timeline, start and finish dates, any additional information, details around any partner organizations that you're going to work with to facilitate the delivery of the project, and then clearly budget items and a breakdown within that in terms of the budget. Now, that's not to say that you need to include all of these elements in any request, but the best sort of requests that I've seen have all of these components. And from my company's perspective, from the compliance due diligence perspective, we would need a lot of these elements to be able to move forward with a project to make that able to be funded. I think it's also important to note that partnerships with industry are not always financial. And therefore, there's many elements of non-financial that pharmaceutical companies can help with. I think importantly, networks and bridge building, many organizations or many industry companies are very networked at the global and regional level. So if you're sitting in a country and you want to build those bridges, then sometimes that can be facilitated by reaching out through headquarters and so forth to try and build those networks. I think importantly, never undervalue your contribution. And so it's really important that you are very transparent around your expectations of working with industry, and industry should be the same back to you. Some of the best examples I've seen have actually been multi-company collaborations, potentially under an umbrella of a memorandum of understanding. I think that's really good in terms of ensuring that all companies have an equal voice, and therefore you can wrap up multiple companies under the one agreement without having to deal with all of those companies through separate agreements. I've seen that work very well. And don't just limit yourself to the pharma industry. Obviously, partnerships with other industries who might want to work with you are really important. And then I think, again, making sure that it's a formal relationship and less of a personal relationship. Now, obviously, as you build trust over time, you'll get to know your pharma industry contacts, but ultimately, you're two separate entities looking to embark on win-win projects that are really going to benefit each party. So it's important that that formality is there. So if we go to the next slide. So these are just a few resources. On the left here, you'll see industry-focused resources, and there's different industry guides here, which really are the code of conducts that all companies that are part of those industry associations need to adhere to, thinking about how to engage with patient organizations. And on the right-hand side is some non-industry examples. So you would be aware of all of the UParty work there. There's the PFMD, patient-focused patient engagement management suite. I suppose, obviously, the links are there and you'll get the slides, but it's important, and I would recommend that you actually read these resources and you have a good understanding of what are the code of conducts in your country or in your region when you think about engaging with the pharmaceutical industry, because it's as much around your knowledge and your protection as it is around the industry and how the industry engages. So it's good to know those inside out there. So if you go to the next slide. So just one example I wanted to pull out from Australia, where I'm based, was the Patient Voice Initiative. And if you just Google Patient Voice Initiative, you'll be able to find more details. But it's a really great example of a public-private partnership where we have, you can see that you have patient organizations, the pharmaceutical industry, the medical device, the healthcare professionals, academia, and government that have come together to really strengthen the voice of patients in the Australian healthcare system. So I just wanted to point you towards that. And if you have the time to go and investigate this initiative, I think it's a really good best-in-class example of how the patient voice can work with multiple stakeholders to have a meaningful impact. So I think that's my last slide, and I'll hand back to you, Ritu.
Thank you, Neil. That was really sharp and succinct and super packed with informative bits. So really appreciate that, and that you came wearing your both hats as a parent and industry representative. And the tips were really useful. Even though I've been doing it for a while, I found it quite refreshingly useful. Yeah, I have so many questions, but I'm sure that the participants in this webinar will have similar ones for you, like when do we know what's the right time to ask? And questions like, what are the key, I really like your reminder that a project proposal should have the key elements which industry is looking for. And my question actually is, how does a patient who's just starting know what kind of questions will be asked and how do they respond in anticipation? So I'm going to make a big ask of you, Neil. if at all it's possible, post-webinar, would it be possible to share some kind of a example or a template? Of course, you could de-identify all the information, any example that may have been successful that had all these elements. That would be super useful for our participants to take and use as the starting point. So yeah, I'm going to stop there, and maybe, you know, in the breakout rooms, our participants will want to ask you, but also finally, a very important point, distinguishing between the personal and the professional. What's a formal relationship and a personal one? I still struggle with that because some of the industry representatives become friends and you tend to see them as allies because they share and they understand. But how do you draw that boundary? I'm struggling with that, but I'm sure I'll get some answers from all of you. So we can pause now and start the breakout rooms. Matt, do you want to introduce us to the breakout rooms where, so I'll just summarize what the intent is, that the breakout rooms now will divide the participants randomly into 3 groups where we will have the 3 speakers of whom you can ask questions. Whatever you were thinking, whatever doubts you have, whatever additional questions you have in mind, they will be able to answer. So this is really a very intimate opportunity to have a one-to-one conversation with our speakers. So you can ask them questions. Our speakers can talk about opportunities and barriers. And what do you wish, you know, I always have this question, like, what's the one thing you wish you could tell me that I should have known when I started my journey? And what are the resources? So most of you have already addressed these questions, but we can start the Zoom breakout rooms. And Matt, is there anything else that I need to tell our participants other than they just need to click on their rooms and join them? Over to you, Matt.
Thank you, Riti. So no, you will see, everyone will receive a pop-up on their screen to once we launch the breakout rooms. Maybe just a quick word on the format of the breakout rooms. So we'll run it so to make sure that everyone gets a chance to ask a question. There will be 3 breakout rooms, but every 10 minutes we will rotate the facilitators, the speakers. So each of the 3 speakers will end up at some point in every breakout room. So the rotation will be every, let's say, 10 minutes more or less, and there will be messages on your screen giving you a heads up when this will be coming up. So with that, I will launch it now, and enjoy your discussions.
Thank you so much, Matt. And I'll be floating around from room to room in case there's any issue. And we have the wonderful PEOF team who will also be accompanying. So if you're lost, don't worry, there'll be someone to help you. Don't panic. Okay, Matt, let's launch. Whoops, we've all been muted. So thank you everyone for staying and welcome back to the main Zoom room. I will ask our speakers to summarize. Eleonora, you have.
Here we go.
Hello. Okay, so where are we? Key insights. Can I request our speakers to please share again in just like some of the really interesting questions you had maybe, and some insights that you felt maybe you had not mentioned earlier. If there's anything new that you want to add.
Can I start?
Please, Joseph.
I have very few questions, but the one that really I think that matters most to me for me as an advocate is the need for diversified funding. Getting funding from a pharmaceutical alone is very difficult enough because the terms of the people that you know, for example, in that company will probably, it doesn't last long. They keep on changing. The people you know in one company will, he probably would transfer to another, and then you will lose your connection in that company, and then you have to explain all over again what you are doing. And so I think we need to look for I diversified funding scheme, like let's look into the foundation, and then another member mentioned about partnering with the medical societies who are willing to do a partnership. I think that's great. We done that. We have done that in our country. And then there is another question here. What advice would you give to patient advocates who are just starting to engage with global collaboration? I think you have to be, when you are new, you don't have a choice but to build your credibility. You have to stay strong because the wind will blow from all directions to make you weak and probably surrender, but never surrender. Just keep on pushing the borders, and eventually, uh, you will have the blessing. Not only the blessing, you'll have the education and the experience that you'll be needing along the way. So I guess those are the two most important things that I've learned from my team.
Thank you. Thank you so much. Ravdeep, any, or maybe
One-liner.
1, 2, 3-liner, Anand?
Will do. No, basically, like Joseph was saying, it's a very difficult part. It's a very tough path. It's the level of commitment that I was asked in one of the breakout rooms. Where do people like us get that kind of energy, commitment, Josh? It's a mixed bag of so many things that we need to make sure that we reach out to other people, get the help when we need. Don't be afraid of asking, and don't be afraid of getting a no for an answer. And
Thank you.
yeah, and like I told you earlier, we keep pushing, and there is definitely light at the end of the tunnel.
Thank you so much. Neil, I just want to apologize to our audience. We are over time, but I think it's really important to hear a quick summary, and then we have a short survey. So if you'll bear with us for just a few more minutes, Neil, over to you.
Yeah, so Richie, very quickly, questions regarding how industry values patient insights and patient engagement. I think that was a good one, and I think industry needs to do a better job at communicating that. There was also a question around how are we generating insights or gathering insights in addition to the increased use of social listening and use of AI, which again, I think all companies are working on that. There was, and rightly so, comments around frustrations in funding and knowing when to approach industry for funding and in their funding cycles, talking around the frustration of what happens when key contacts leave and how do you continue to stay engaged, and then also talking about when companies reduce funding, rather than just turning it off cold. There should be a mechanism to have a softer landing on that, which are all things that industry needs to work on, and took that on board. There was also one final request that I would share some form of MOU template as an example, multi-company collaboration template, which I commit to doing, which then groups could potentially use locally in multi-company collaborations.
Thank you so much, Neil. That would be such a value add. Really appreciate that. Eleonora, could we go to the next slide? I want to thank all our audience for being here with us this evening, for your questions. It was absolutely brilliant. Thank you, Sheila. Very, very kind of you to say that. And we have a few questions, if you don't mind giving us some feedback so we can come back better and more relevant to your needs. So here's the link that Eleonora has shared on the chat, and there's a QR code if you can scan. Let us know how we did, and let us know what you want to hear the next time. We'd like to come back with content that's relevant and important to you. So please keep this engagement going. Please send us questions, get in touch. There are many ways of getting in touch, but we can send our emails at the end. But our next session is on HTA, a topic that is super relevant to all of us. And I think a reminder, even for those who are familiar, would not hurt. So we aren't entirely sure of the date, but tentatively we have, Eleonora, is it December 5th?
December 5th. December
Yeah.
5th, yes.
Yeah, tentatively we are locking in December 5th, but if that changes, we'll keep you
Same
posted.
time as today.
Yes, indeed, same time, and we hope to see many of you. So thank you for joining from all over the world. So grateful. Keep in touch and have a good evening. And thank you to our speakers. A sincere thank you to the PEOF team and our speakers. Good night, everyone.
Thank you.
Thank
Thank
you.
you, everyone.
Bye-bye.
Thank you,
Bye-bye.
Rita.
Thanks, Eleonora. Thanks, Ritu.
Bye.
Thank
Thank
you very
you.
much.
Bye, everyone.
Bye.